on the rollout of emergency services in the country. And this workshop has involved coming together with the National Ambulance Dispatch Committee, that is a multi-stakeholder committee set up at SHA that has SHA participation, but also participation of development partners and agencies who are working with us to ensure that we roll out emergency services in the country. One of the key crucial partners that we have is the Emergency Medicine Kenya Foundation. That is a thought leader and partner that has helped us roll out and really put together the packaging and implementation plan of the rollout of emergency services. So what exactly are these emergency services and what is SHA working on? And I'll begin with our constitutional mandate. The Constitution mandates that all Kenyans should have access to emergency care services and that it is their constitutional right. So to be able to implement this, SHA, together with the Ministry of Health, has been working over the years on setting and putting in place a policy framework that allows investments in emergency services within the country. SHA has come in to be able to put in place interventions that touch on the financing pillar of this investment. And how SHA will do this is by rolling out dispatch services and emergency care services for all Kenyans. We do intend to roll this out within the next 2 months, and this will be graced by His Excellency the President, whereby each and every Kenyan, whether paid up or registered into SHA, will be able to pick up the phone, dial a toll-free number, inform the dispatcher that they have an emergency, and SHA will be able to then dispatch an emergency evacuation ambulance to them. And this ambulance will move this Kenyan from the point of emergency to a designated emergency hospital or care center, an ECC. And this process will be supported by a fully digitized electronic system. This system will involve, one, being able to identify where the Kenyan is, being able to identify the nearest ambulance to you, being able to identify the nearest emergency care center that is near you, and being able to ensure that you can dial using that toll-free number and have the evacuation conducted. Once the evacuation is conducted after initiation in the system, SHA will then undertake to reimburse that evacuation at the rate of 4,500 Kenya shillings. This will be paid by SHA, and for you to access this service, you do not have to be a SHA member. You do not even have to have registered for SHA. You simply need to be in an emergency, be in need, have called the toll-free number, and the dispatcher will determine the level of your emergency and the need that then you have for a dispatch service. Now, if this dispatch service needs to happen beyond a distance of 25 kilometers, SHA will also take care of that evacuation, and we have worked out how those tariffs will be computed. These dispatch services are not only limited to road ambulances, they will also be affected by use of water boats in counties who use water transportation for evacuation or even for normal transport needs. Now, once the evacuation has been conducted, we will then also take care of the first 24 hours of the emergency. Our team and in our SHE regulations, we have defined what the emergencies are. You as a Kenyan need not to know what the emergency is. Our dispatchers, once you call them, will be able to filter you through the system and determine that that indeed is an emergency and activate the evacuation for you. Once you get to the emergency department, the hospital then will be mandated to provide you with emergency care for 24 hours. SHA will pay for that service for 24 hours. Thereafter, it then becomes important for you to be a paid-up shift member, so that then SHA can come in and take care of the remnant costs after 24 hours on a co-charging mechanism. And so it's very, very important that all Kenyans understand, yes, the evacuation is free, conducted by government. Yes, the first 24 hours are free for you as a Kenyan. However, after 24 hours, there'll be two pathways you follow. If you are a SHIF paid up member, SHIF will kick in. If you are not a Shift Paid Up member, you will have to get into your pocket and pay cash for services after 24 hours. And so we are rolling out this program. Look out for it. It's in the next 2 months. We'll be able to really ensure that all the infrastructure that we need to roll this out is available and ready to go. Now, one of the key partners, as I mentioned earlier, is EMKF. They've really supported us, one, in helping us define the policies at the Ministry of Health, in helping us define the protocols, in supporting the training of our dispatchers, and they'll continue to be our partners as we roll out this program for all Kenyans. And so I'd want to invite Professor Wachira to really give you the technical component of what it means for Kenya to set up its emergency care services. Dr. Wachira.
Thank you very much, and thank you, CEO, for this. I think it's a very big deal for Kenyans to actually finally have an ambulance service, public ambulance service that runs across the entire country. For many years, we've had mothers dying trying to get to hospital, people in accidents being supported by the public to get out of the accident scene, and many people dying before they even get to hospital. I think with the rollout of this entire emergency healthcare system supported by SHA, I think it's a significant milestone that will see a significant reduction in all the health metrics that we all normally measure, things like maternal mortality, under 5 deaths, and even just road traffic crash deaths. We'll see a significant drop in the numbers. So the ministry, again, through and SHA, are using the WHO Emergency Care System Framework to develop this system, and it's being rolled out in a way that is sustainable to ensure that these emergency healthcare services continue to exist for every Kenyan. And as the CEO has mentioned, it doesn't matter whether you're a SHA member or not. All you need to do is call the number that will be provided, and you don't also need to know exactly what specific emergency. If you're in any emergency, you call the number, the dispatch center will be able to support you and provide the necessary information for you, first of all, to provide that first aid care, and then subsequently the ambulance services to transport you, to provide care for you out in the community and into the nearest emergency center. So in the whole process, again, remember, for the longest, people have had to get care when they get to hospital. What this system is going to do is now start providing care out in the community, save your life out in the community, and transport you to a facility that is able to then continue the care that you'll have received out in the community from the trained responders that will be responding. So it's an exciting milestone. It's actually, I mean, we've all seen the TV series of 911 and ER and all that, and hopefully then as a country we'll be able to get to that level, but more importantly, we'll be able to save very many lives that are lost before they get to the hospital. So it's a great day, and we look forward to working together with the government to roll this out and the success of this program. Thank you.
Great. That's it. Done. Naito. Yeah? Thank you. Thank you, guys. Hiya. Thank you. I know, right? You chose to wear scrubs today.
I wish people leave.
Tell me if you did.
I know, right? Yeah. You guys are feeling well done now. Roll out, roll out. I think we need a lot. You guys said.